Hi, this is Dr. Lynn Herpy from Austin Park Dental. I wanted to talk to you a little bit about your dental insurance and what you should know about it, because there's a lot of confusion and it's important for you to know about your own coverage. So, first of all, dental insurance is not like medical insurance. What people refer to as dental insurance is more accurately thought of as dental benefits. Insurance in the dental industry has not even changed much since the 1970s. The deductibles are about the same, the benefits are about the same, and obviously the economy is not the same. So really, dental benefits are meant to help in paying for dental treatment, and they don't really cover the majority of treatment, although there are exceptions to everything. So I'm going to explain to you a little bit about what you should know about your dental benefits so you can be more of an informed consumer. Not all insurance companies provide cards anymore. So if you don't have a card from your employer, don't panic. You may have a booklet that somebody gave you from work, or you have a telephone number, or you can look up online if you know your coverage. So don't worry about that. But you need to have some type of telephone number or online source so you can call or contact the insurance company to find out a little bit more about your coverage. So I'm going to go over a lot of the things that you should ask when you're talking to them, and I'm also going to include with this a little handout so you can have it ready, and when you're talking to the insurance company or you're going online or looking through your booklet, you can kind of fill it out so you understand and know what's going on. So I'm going to tell you a little bit about all those things. So the first thing you should know is whether your coverage is a DMO or a PPO or neither of those. So basically, a dental management organization means that you can only go to a preferred provider who's contracted with your insurance company, and you can only go to those providers or you don't get any benefits. And a PPO is preferred provider organization, and they usually they'll have a list of doctors that have contracted and are working with the insurance company, and you get benefits with them. But a lot of times you can go out of their dental network and see other providers, and it may or may not change, what type of insurance coverage that you have. So it's good to just understand that a little bit before you even get started. If the insurance coverage that you have is new, then you need to find out if you have a waiting period, because there might be a period of time that could be as much as a year where your insurance actually doesn't pay for major treatment or cleanings are covered. It totally depends. It can change from insurance company to insurance company. So that's something that's kind of important to know, because you may be thinking, I'm paying premiums to my dental insurance, but I'm not getting any coverage. So it's kind of important to know. Another thing is that's different with dental insurance is you have a maximum benefit. So that means during the course of a year, and usually it's January 1st to December 31st, but not always, there's a maximum amount of money that your dental insurance company will pay towards your treatment. And every coverage is different. So this could be $500, it could be $750, up to $2,500. And occasionally we'll see one come to the office where they don't have a maximum. So it's just important to know so you understand, because if you need a lot of dental treatment during the course of a year, you know when your benefits run out, and sometimes you can wait till the following year to continue with your treatment so you can maximize those benefits. And here at Austin Park Dental, we always try to go over all these things with you. So don't worry. We're going to know all this information, but it's good for you to know it too, so you kind of understand what we're talking about. Also, you have a deductible, which is kind of similar to medical insurance, and that varies by insurance company, by insurance coverage, not insurance company. So basically, when you're thinking about dental insurance, it's about your plan, not which insurance company you have, because each insurance company has probably thousands of different plans with thousands of different employers, or you can even get insurance on your own sometimes. So the deductible is the amount of money that the patient has to pay out of pocket to the dentist before their dental benefits are provided. And this is usually applied yearly, and sometimes it's applied, before you have any dental treatment, and sometimes they'll let you have the dental cleanings, and that's covered 100%, and then the deductible only applies to fillings or crowns or whatever. So it's something you should ask about. Another thing is that you should check on your eligibility for radiographs. So dentists have to take x-rays periodically to properly examine your teeth because we can't see everything. And when you come as a new patient, and usually every 5 years, it's important to take either a full mouth series of x-rays where they take 18 individual films, or a panoramic x-ray that goes around your head so we can see all your teeth and the bone that's supporting it. And generally we'll take 4 bite wing x-rays once a year, and that helps us to see in between your teeth. So when you're checking for eligibility with your radiographs, because maybe if you change dentists, you need to know, because you might not remember when you had your last full mouth series, so you can see if you're eligible to have them taken and they'll be covered by your insurance. And we once again, we check on this for you too. So then, say you've had your cleaning and you know you need some treatment, the coverage that you receive from your dental insurance, or dental benefits, I should say, varies. So, and it can go from different ways. So they could choose, your insurance companies could say, we pay based on a percentage of the fee. And this is where it gets a little tricky, because you don't really know what fee. It could mean the fee that the dentist or your dentist charges, but it could also mean the percentage of a fee that they randomly set, and you don't know what it is, and we don't know what it is. And sometimes you'll get that information in your booklet, sometimes you don't. So it's a little bit tricky. So the lower your insurance premiums are, usually the lower the fees that they're based on. So sometimes, you can be told at work, oh, our dental insurance covers 100%, but it doesn't really cover 100% of what the dentist is going to charge. So it's kind of misleading. And once again, we will try to figure that out for you and help you with that. Also, other insurance companies can base that on a fee schedule. So that just means they kind of have like a menu of all the dental services broken down into the insurance codes like that we use to submit to the insurance company when you have treatment. And they might have for each code a certain fee that they'll pay, or a percentage. Once again, it goes back to the percentage of those fees. So it's kind of important to know. Okay, and when you are talking to your insurance company, no matter which way you are, you should find out how they're paying percentages for preventative treatment, basic treatment, and major treatment, because the percentages will vary amongst those different categories. And some of the common clauses that come up when we're dealing with patients that people should know is one is the missing tooth clause. So if you're needing to have a tooth replaced because we just extracted a tooth, your insurance company will want to know when the date was of your extraction, and then if it's recent and you've had the same coverage in effect, generally they will cover replacement for it in their various ways, and we'll talk individually to each patient about that. But say you lost your tooth 10 years ago and now you want to replace it with a bridge, they might say, oh, you know what, you have not had that, you had that tooth taken out so long ago that we're not going to cover it. It's been over 5 years, which is our missing tooth clause. So that's something we need to check on. Also, there's a replacement period. So that means if you have a crown or a bridge or dentures, if you need them replaced, they usually have a set period of time between when you had the last dental restoration and when the insurance coverage will take care of the replacement. And once again, this totally varies by your insurance plan. So it could be 3 years, a lot of them are 5 years, and we're noticing more and more it's going to 10 years. So that's just something to kind of keep in mind, and we'll check on that as always. So I hope I haven't totally confused you. I know this is really a lot of information, but it's good for you to know, and we're always here to help you get through all of this. And I'm going to, as I said before, I'm going to give you a worksheet so that you can fill it out when you're speaking to your insurance company, so you have the information and you know. Because we'll go over all these things with you, but we know when you're at the dentist you might get a little confused and you're thinking about you're in pain or how much is this going to cost, and you're not really understanding what we're talking about with the dental insurance. So I wanted to give you a little bit of a rundown of what dental insurance and dental insurance benefits really are. So I hope this helped. Okay? Thank you. This is Dr. Lynn Herpy at Austin Park Dental. Thank you.